ahead of 6 o'clock, and we'll get started very shortly, but it's great to see so many people interested in this, and we'll get this moving in just a few minutes. Thank you. Good evening, everyone. My name is Patty McKegg, and I'm the Director of Communications with the City of London. And I want to welcome you to this community information session on the City of London's winter response plan. As some of you will notice, we're using Zoom, obviously, this evening to host the meeting. And just to give you some additional information, we have muted and disabled all of the participants' video and microphone. So we'll be using the Q&A function on the Zoom meetings to receive questions. And at the end of the meeting, we'll go through and we'll do our best to get to all of the questions that you provide about this plan. If time doesn't allow us to get to all of the questions, we will capture the questions that we don't get to and make sure that a member of our team addresses it, and we'll post the answers on our Get Involved site. So with that, I'm going to turn this over to Craig Cooper, who will be facilitating our information session this evening.
Great. Thanks, Patty, and welcome, everyone. I look forward to a great conversation tonight as we talk about the winter response at our information session here. Before we get going, I'm just going to provide a bit of an agenda for tonight's session. I'm going to introduce myself, some team members, as well as a couple of agencies that might be on the phone with us tonight, as well as I'd like to provide a land acknowledgement before we get going. So the agenda will discuss a little bit about the situation of the homelessness situation here in London. We'll talk a bit about the proposed winter response, identify some next steps, and then go through some question and answers for you for tonight. So before I get moving forward with our introductions, I mentioned I would like to do a land acknowledgement. So we acknowledge that the land on which we gather is the traditional territory of the Adirondack, the Anishinaabe, the Haudenosaunee, and the Lenape peoples who have long-standing relationships to the land, water, and regions of southwestern Ontario. The local First Nation communities of this area include Chippewa of the Thames First Nation, Oneida Nation of the Thames, and Munsee Delaware Nation. Additionally, there is a growing number of urban Indigenous population who make the City of London their home. We value the significant historical and contemporary contributions of local and regional First Nations of Turtle Island, which is North America. So thank you. As mentioned, my name is Craig Cooper, and I am the Director of Housing Stability Services here at the City of London, and I'll be walking you through our presentation tonight. With me tonight also is Deb Kramers. She is our Coordinated Informed Response Manager here at the City of London and works very closely with a number of our agencies as well as our unsheltered homeless population here in the city. In addition to Deb, we have Sarah Campbell, who is the Executive Director of the Arcade Street Mission. Sarah is a key instrument and partner in our work this year, but also the work that we did last year in the community as a result of COVID. So with that, we'll move forward on to some conversations. So as we all know, homelessness and housing are a community issue that require all hands on deck. Individuals experiencing homelessness and housing issues are our neighbors, our friends, and our family. And we need to take care of all of our community members and all Londoners. So we are working collaboratively with these community partners to create community spaces for our winter response. And as you can see by this slide, there's a number there's a lot of information on this slide, specifically around the city's by name list. And so the city maintains a by name list. And what is that? It is just actually that. It's a list of individuals who have identified to be experiencing homelessness and actively working within our system. So as of November 4th, there were a total of 1,424 individuals in the city on our by name list. So of that, there were 868 men, 532 women, 24 LGBTQ2S plus individuals, 279 individuals who identified as Indigenous, and approximately 125 individuals living unsheltered. So unsheltered homelessness, as you can see by the definition there, are for people who lack housing and are not accessing emergency shelters or accommodation, except during extreme weather conditions. And in most cases, these individuals are staying in places that are not designed or fit for human habitation. So the City of London is just a single partner in the work that we're doing to solve the housing and homelessness crisis our community is facing. It's not something one agency can accomplish in isolation, and it's why the city works quite closely with a number of partners across the city and the county to help address our housing and homelessness concerns. So to walk through a little bit of the winter response considerations, as we know, the project focused on the need for unsheltered individuals, especially those who are experiencing trauma, addiction, and mental health. The multi-pronged approach we're going to talk about tonight is designed to meet the needs of those hardest to support and those experiencing unsheltered homelessness with no other options. Many of the services we're going to speak about tonight are offering low barrier services that help support individuals where other resources are not available to them. All the details related, as you can see on the screen, to food site food needs, security, and various collaborations are at various stages of discussion. And these discussions continue on and will continue on beyond Council's consideration of the proposal on November 16th. So our Housing Stability Services team completed a pretty exhaustive review of our current underutilized city-owned properties. There's approximately a dozen of those properties that were considered both in and around the core, as well as outside the core. We worked with multiple internal stakeholders to determine the viability and options for the current proposed response. And the reality is that there are very few properties across the city that are able to accommodate the needs of the various proposed responses. I will note that no private properties were considered for part of this response, and that was based on direct feedback we had received from Council last year as part of the previous winter response. The properties that were considered that were of the underutilized sites, those that were not identified as viable sites were done so for many reasons, including the state of the winterization of those properties, and then the capital and time investments that it would take to bring those properties to a level where they could accommodate this response. That was really fairly prohibitive. So part of the response and considerations of a response were also to look at sharp safety practices and needle sweeps of all of the areas. So as per Council direction from last year's responses, we are incorporating needle sweeps around the sites and working with agencies that are funded to operationalize these spaces to make sure that that occurs. We're also providing harm reduction kits available to participants through our community partners. And we note transportation will be arranged by each agency, and the method will be determined by the agency for each site. We recognize that there are some transportation concerns with the remoteness of the locations that have been identified, but we do feel that with agencies working with individuals, that many of those minor transportation concerns can be addressed fairly easily with the agency and the individual who's looking to access those spaces. We'll highlight and probably highlight a number of times tonight that these spaces are choice-based, They are for individuals who want to access the spaces, and that is why part of the response tonight is looking at a multi-pronged approach. So for COVID, because we were still dealing with the pandemic, we do continue to follow all Middlesex London Health Unit COVID protocols. We've been working very closely in our community and with a number of our service agencies here in London to provide protocols for accessing our isolation and monitoring space, include screening of participants, as well as education and facilitation to vaccine clinics should the participant not be vaccinated and wish to be. So many of those protocols will be included in this year's winter response. I will also note that all funds for this year's response are being used from the one-time federal and provincial COVID-19 programs, and that there will be no net impact to the municipal tax base. So now on to a bit of a discussion about the proposal. So we are looking at a three-pronged approach that is going to allow us to tailor services to various needs of Londoners experiencing housing and homelessness challenges. Taking lessons from a number of last year's emergency winter response, our team's looking to decentralize a number of services and enhance the housing focus and Indigenous service delivery. As we know, there are already a significant number of services in the core, from a number of existing emergency shelters, motels for our physical distancing spaces, various number of low barrier resting spaces for individuals, crisis beds, community meals, and other services. So we recognize that there is quite a bit of service already in the core, and that our models that we're looking for the remote areas are choice-based. So we're trying to create a yes, where everyone else for these individuals has said no. And that can include people being banned from services. It could include drop-off from hospitals. It can include reasons for them not being able to access services as related to a mental health, physical, or trauma-based concern. And a lot of times individuals who are experiencing unsheltered homelessness aren't functioning well in the existing communal or cohabitation spaces that are currently available within our system. Right now, we don't have options for individuals wanting to get out of the core, and those possibly wanting to look at alternative options don't have any. So individuals are being abused within the very system we're providing to protect them, and abused women and men, individuals with developmental delay, and those desperately trying to get out of their street substance use and for being forced to deal with various other challenges. So individuals through our engagement have told us they want out, but are stuck in the cycle. Those are the people we hope to provide for the number of remote responses. So prong one is our day drop-in space, and this is the space that's going to be operated and provided by Arcade Street Mission. They're actually already operationalizing this space and have been operating this space since, I think, early 2021. As I look for a nod from Sarah, that is correct. So these day spaces are really focused on providing that warm space for individuals to get in out of the cold. It allows them to access basic needs and build a sense of community within a socially distanced environment. So as mentioned, the response is staffed and operated by Arcade Street Mission. They will be hiring third-party security to help support any needs that they have, and they have a very robust list of community volunteers who have helped support their existing response and to continue supporting this response through the winter months. So the site is proposed to be operational 7 days a week, and that also includes holidays. So as noted, the Arcade Street Mission are continuing to build relationships with the neighborhoods in the area and engage in the provided needle sweeps for the immediate and surrounding area. So the additional overnight spaces for prong one, location is still being confirmed, and I don't think we can share that detail yet with Sarah. I know her and her team are working quite heartily on being able to get those agreements in place. But this space, again, is an overnight drop-in space. It's at a separate location than the YMCA, and is going to focus on providing a warm space for individuals to access basic needs and rest. So the great thing about having this space in a different location is that there is no gap for individuals who may be accessing the day resting space and need to access the overnight resting space. There is an option for them to transition right in from one support service to another. So again, this proposed response is for 48 spaces, and it will be staffed by the Arcade Street Mission, as well as third-party security and their team of volunteers. Again, the site will be operational 7 days a week, including holidays. So a bit of an agency profile for the Arcade Street mission. The mission was founded in 1984 and has been serving marginalized and homeless populations in London for over 35 years. The operation is definitely heavily reliant on volunteers, as many of our agencies are, and engages with approximately 450 community members on a monthly basis to help deliver their various programs and services. Since its early years, the ARC is popularly known as the ARC, as it is popularly known, has grown its mandate to serve people who live on the margins of society. It's a charity that is registered with Canada Revenue, and like I say, supports a wide variety of people in the community. Moving on to prong 2, our stabilization spaces. This is a space that's going to be operated by the Canadian Mental Health Association, Thames Valley Addiction and Mental Health Services. It's a mouthful nowadays. They went through a pretty significant reorganization earlier over the past year, and that is their new name. So this space is a 24/7 operated space for approximately up to 10 stabilization beds. So Civic Administration has really sought in the past to provide this much needed resource in our community for individuals experiencing in the moment crisis. Though the ability to operate this type of intervention on a permanent basis is not yet achieved, we do see the benefit, and the opportunity does exist for a temporary service to serve a specific population through a unique partnership with our community partners. So CMHA will continue to build on the relationships with the neighborhood and engage as appropriate. Impact London will support the operationalization of these stabilization spaces on the 24/7 model. And we're asking, and part of our contracting will be requiring the social service providers to provide needle sweeps of the occupied property immediate surrounding area. As you see from the slide, it's not a drop-in space, but it is a referral space that can be made through the new COAST, or the pilot COAST program, the London Police Service, and our coordinated informed response team. The site will have a controlled entry and will provide private space for individuals to stabilize and then support engagement and clinical work with individuals. So individuals in this location may stay for a period of 24 to 72 hours and will be able to receive direct professional care while on site. So a bit of an agency profile here of the Canadian Mental Health Association, Thames Valley Addiction and Mental Health Services. I don't want to see their business card down the road. They do offer a continuum of community-based mental health supports for individuals that are 16 over across London and region. They're an inclusive community with that focus on mental health and well-being for all. And as mentioned here, their values are accountability, compassion, integrity, welcoming, innovation, and inclusiveness. Things that are going to be supported, very well supported in the stabilization space if council approves our response. So prong 3, looking at our winter shelter area. So the site is, the first thing I'm going to speak to about is our Indigenous led initiative. It is the location it currently is moved to be. We understand that there has been some significant challenges this past weekend to the River Road site, and our current team are evaluating what the outcomes of those challenges are going to be to this response. But we are focused on offering that Indigenous-led response here in London. We see a significant growing need for addressing Indigenous homelessness here in our community, and we need to give those participants an opportunity to reconnect with land, culture, and home. It's very, very important for us to identify this as an Indigenous-led response. So the spaces will be provided through heated temporary structures for sleeping and other resources at each location for meals, programming, and service agency interactions. They're going to incorporate construction fencing as appropriate, and the target demographic for this space are individuals experiencing unsheltered homelessness and prioritizing those who identify as Indigenous. Wraparound services and cultural specific services will be available to assist individuals make the transition from street to shelter. So at LOSA Family Healing Services is the agency identified to help us support us in this Indigenous-led response, or for us, I should say, to support them in this Indigenous-led response. They have been an organization that has been very active with our housing and homelessness sector and work quite closely with my team. They have been around since 1986, and they do provide, as you can see, low barrier wraparound services to community members. So in addition to their mission, vision, and values, they do really focus on acceptance, safety, family, and empowerment. They want to meet people where they are at in their healing journey without judgment. They want to provide a safe space for community members, ensuring a strength-based, trauma-informed approach. And they acknowledge the unique role and contribution of all members of the family throughout the lifespan. They like to hold space for each community member to take leadership in their own healing journey in their own time. So moving through to prong 3, site B, is our winter shelter response at Fanshawe Golf Course. So this location is going to be focused on individuals who are housing ready and very focused on housing related initiatives to support the unsheltered homeless population. It provides for an opportunity for individuals to actively work on housing, to have shelter space that supports their efforts, and to achieve their housing stability. So we've tried on a number of occasions, we've heard from a number of occasions that people need help to find, obtain, and remain housed. This work at this site will help them do that. So again, the space is utilizing heated temporary structures for sleeping and use of a portion of the existing clubhouse at this location for meals, programming, and service agency interactions. The space will incorporate construction fencing for safety, and services provided to the participants include access to washrooms, showers, basic needs, and support services. We use the term paper ready, as you'll see here, with the target demographic being unsheltered individuals who are actively working towards finding housing and are paper ready. So paper readiness in our system and through our coordinated access system is a term you use to ensure that someone is able basically to sign a lease for housing. And there's 3 basic requirements to be considered paper ready. It's that you have identification, you have a confirmed source of income, and that we've been able to identify your support needs through an assessment. And so we have a variety of needs across our system, but paper readiness allows us to work within the private market, nonprofit market, to support individuals in the choice of their housing and achieve their housing stability. This site is going to be operated by Impact London. So a little bit of an agency profile here for Impact London. They're a peer-led, non-clinical organization that is serving the community. Currently, Impact London supports our isolation and monitoring space and have done so since the beginning of the pandemic. And they've supported individuals that struggle with homeless quite a bit through the pandemic. They're passionate helping others move through their journey without stigma or restriction. Creates a relaxing atmosphere for their clients and regenerate and allows them to rest and regenerate while they enjoy snacks, refreshment during their time in isolation transition. They offer a wide variety of services and support, like as mentioned earlier, our isolation monitoring space. So some of the on-site items that we've heard through committee that we were asked questions on were around security on-site and in community. So as we note, for the city-owned sites, we'll be contracting a security agency to support the operations of both the Indigenous-led location and the Fanshawe Golf Course site. The core area sites will be able to secure their own contracted security for each location, and those costs will be identified and built into each budget. Individuals do have some check-in requirements with security before being granted access to the site. Both sites are not for drop-in style spaces, and general visitors will not be permitted to attend the sites. So as mentioned, there is a check-in, check-out policy. So we want to have that so we can ensure the safety of both individuals on and off the site. The security will be providing regular sweeps of the area and patrols of the space. So we also heard some comments around infrastructure. So as we noted, the winter shelter spaces are to be provided through heated temporary structures for sleeping and use of a portion of the existing clubhouse for meals, programming, and service agency interactions. So all spaces are utilizing construction fencing for safety where appropriate, and services for provided to the participants, as mentioned, for washrooms, showers, basic need items, and support services. The core area spaces are provided within existing buildings, either owned or leased by the agencies being proposed to be contracted for this response. But we've been assured that each site can support the proposed number of participants. So as we look through some conversation and considerations around transportation, we appreciate that transportation is a key component of the non-core locations and their responses. The non-core spaces will be matched to individuals who choose to stay there, as I mentioned earlier, and who are looking to get away from the challenges of the current core proposes to them. Transportation to and from the core or locations are facilitated by the on-site staff, and each location will determine their transportation needs, and flexibility is very important consideration for each response. The agencies, as they work with each individual on their planning, will understand what their needs are, where services can be brought to the space to support them, and where they might need to access supports in community. And that would be done on an individual per individual basis. It's a little bit of a conversation around last year's response, what we had budgeted and council approved, and what the actuals came in at. As you can see here, the cost of budgeted to be around $2.3 million, and we came in at just under $1.7 million, with a variance of savings of around $618,000. And the great thing about that is those funds, although they were identified through our provincial and federal programs, they're able to be reutilized and repurposed for additional supports and services for individuals during the COVID pandemic. So we're currently in the stage of retrofitting and moving trailers, looking at furnishing and supplies and other associated costs that we build into these budgets to help support this response. As I mentioned earlier, there is no expected impact to the municipal tax base for the delivery of these services. So what are some of our next steps? So our plan received initial endorsement at the November 2nd, 2021 Community and Protective Services Committee. We're holding this information session tonight to inform the public of the plan. So we've also included a social media campaign that's currently running to inform Londoners about the response. We've established a Get Involved site on the City of that Londoners can visit, receive regular updates about the report and the plan, as well as provide feedback to our teams. So that site, like I mentioned, hosts information about the response. Our plan will go to council next Tuesday on November 16th for hopefully final approval. And then sites are planning to be operational on December 1st, with the core overnight spaces fully operational by January 1st, 2022. So with that, we'll open it up for questions, and I'll turn it back over to you, Patty.
Thank you very much, Craig. We do have a number of questions that have been typed into the Q&A feature. For those of you who may not be familiar with it, it's the Q&A icon. If you type your question, then I'll read it and pose it of our panel, and we'll do our best to answer you. Ideally, the intent is to answer questions. So I know people may have comments, but we can accept those in a number of ways. In the interest of time, we'll try to get to the questions so we can clarify any information that people may not be understanding. So Craig, I'll start with a question around just the properties and the neighboring. So the question is, will there be needle sweeps on neighboring properties? And I wonder if you might want to stop sharing your screen as well.
All right, there we go. I'm multi-screening tonight, so my apologies. Sometimes meeting with people in person is much easier because you don't have to multitask with all the screens. Generally, our needle sweeps are for the public spaces in and around the responses. I know for a number of the responses last year, we did have some conversations with neighbors about how to access needle cleanup kits for themselves, and provided shared some information on the training video to inform individuals about how to clean up needles. I would suggest that there are concerns to continue to make the comments, and we can, as we look to sort of operationalize the space, we can have some conversations with the agencies that are operating the spaces.
Thank you, Craig. We have another question around the kind of professional care that the Canadian Association for Mental Health and Thames Valley Spaces will offer. If you can maybe provide us some additional information about that.
Yeah, sure. And a great question. Appreciate that, as is the first question as well. I think as we look to operationalize the stabilization spaces, we're really being able to try and find that space for individuals that are experiencing that in the moment crisis. So the prime feature of that space is to be a low barrier space and provide individuals that opportunity to stabilize. It then gives the agencies and the clinical experts at that space the opportunity to then engage with individuals for whatever their needs might be, whether it be mental health, addictions, or trauma.
Thank you, Craig. There's a question around community consultation and then notifying the neighborhood. So a resident is interested in wondering what type of process happens in terms of community consultation, and perhaps the considerations around what happens or what doesn't happen prior to the report coming to council.
Yeah, sure. And so it's a great question, and one I've been asked a number of times, I'm sure, and one we get asked all the time as we do and implement the programs and services for our housing and homelessness portfolio. We work very closely with our funded service agencies through our homeless prevention network. So those are agencies that are funded through the city to provide services. We do consult with them quite regularly. We meet with them quite biweekly and do share resources and seek opinions and input from them. We also have a London Homeless Coalition, and that body is really for all non-funded individuals and agencies that have an interest in understanding the work that the city is doing for homeless prevention as well as housing. Like I say, a number of advocacy groups that work and attend those meetings, and we all consulted with that group as well as part of the winter response. The biggest challenge for us this year was around the details around the funding and the sort of response that we had to provide. It is always a balance as we look to consult with community members around our responses. And it is a bit of a balance of what you do before council committee and what you do after council and committee. And so we are continually engaged. We are committed to be engaged, and that's why we're having this session tonight, as well as the opportunity for people to continue to provide input into our response.
Thank you, Craig. Are there any plans to provide flyers to the residents who are in the neighboring communities?
With the timing this year, we were not able to provide flyers, and there was no intention to do that. That's why, working with our great comms team, we work to provide that social media campaign and information on our city website and the Get Involved page. We've used that for a number of initiatives previously that our team has operated on, and it's a great tool for us to be able to connect with community as well as individual Londoners that have concerns or questions or support the programs and operations that we implement.
Thanks, Craig. We have a question related to people who are not taking part or able to access the services through the program. So people who are maybe still in encampments or not participating in any of the three prongs that you discussed.
So as I mentioned earlier, there still are a number of services in our community. Debbie, maybe you'll speak to the work that our coordinated informed response team does every single day, as we have our outreach teams working with individuals who are living unsheltered or in encampments to try and get them connected to supports and services. It's especially paramount during the winter and the cold weather alerts, as we recognize that is a life-saving or a life-threatening condition, and that intervention by those outreach teams could be life-saving. So I don't know if Debbie, you want to talk a little bit about a typical day in the CIR world, but I'll turn it over to you real quick if you like.
Great, thanks very much, Craig. Yes, we don't leave people outside unattended or not engaging with our teams. CIR is definitely visiting any reported or known site of encampment or sleeping rough. Our team consists of a very large outreach team, and they are the first people to arrive on scene when we are aware of anyone who's out there. And as Craig spoke to, the first thing is always basic needs, and part of that basic need is sheltering, offering resting space, seeing what we can work with the individual so that they aren't staying in out in the cold, especially in the winter. With the day and night rest, last year's winter response, we used day space quite a bit to have individuals go and get in out of the cold, dry their socks, get new socks, get some warmth and some food. And that is what this response is going to be. That large response we have in the core is daytime and nighttime for individuals. So if we come across them in the middle of the day, the middle of the night, those spaces are available to them to get that in out of the cold care that they will require.
Thanks, Deb. Oh, I'm just going to add real quickly there, Patty. If you do witness an encampment or see an encampment that you'd like to report to the city, the best way to do that is service@london.ca. It is then logged and actioned to our outreach and CIR program teams for response. And we always have an initial care and compassionate response for individuals, whereby the outreach team will go out and, as Debbie mentions, try to engage with the individual to understand what support needs they might have to move towards changing their current situation.
Thank you, Craig. This is a question about the budget slide that you showed. Why were the food and beverages expenses so low?
Yeah, that's a great question. And the budget for us is it's one that we constantly are on adjusting, because Londoners are kind, and we have a lot of great partnerships in our community, as I'm sure Sarah could probably attest to. Londoners come to bat when there's a need in community. And so last year we had a great partnership with the London Food Bank to provide meals to all of our services at no cost. In addition, many of the snacks were donated to our daytime spaces from Fanshawe College Culinary Program, so that we were able to save those costs on food to provide services for those individuals.
Thank you, Craig. Another question. Do you know how many people were able to access housing as a direct result of the WISH response last winter?
Yeah, I can probably turn that a bit over to Sarah if you want to answer a question there, Sarah. I think I know I have my number, but I'll let you answer that question directly.
Sure. We had 35 individuals transition from the winter response all the way until June. So there was an extension on that to either housing, transitional housing, or another sheltering option. So whether that was like a long-term stay in a shelter within our system or city, 35 people transitioned that way. Also, the City of London supported Wish to Be Home, where we still currently are supporting approximately 20 people from winter response last year. So the average number of days that the people who we're still serving within that transitional housing program is now 270 days on average that those folks have been indoors and working towards a graduated housing model towards that long-term goal of permanent housing. So if you count the current Wish to Be Home transitional housing, as well as the housing that people moved right out from winter response, the total number that moved into housing would have been about 55. Of that, we've actually tracked our participants as best as we can. And it seems that about 25 folks have maintained housing to some level or degree, or sheltering. I don't want to say housing, because housing means forever, and we're really going for that. And we're still working towards that. But 25 of those that were transitioned out are still housed. And as I mentioned, 20 are with us at the Wish to Be Home transitional housing project at 186 King.
Great, thank you, Sarah. I think this may be for Craig. What are the best estimates for the number of homeless currently in London? And what is the capacity to provide housing? For example, the number of spaces from all sources. So considering Mission, Salvation Army, ARC, Project Hope, Sanctuary, etc. And what is the gap in those numbers?
Thanks, Patty. That's a great question, and one that I think we struggle with. And if I had the answer for absolutely, we'd have them be able to put that number to council. I think what we look at is the real key for us is individuals who are experiencing it and are accessing services, and so that's our by name list. We'll never actually know the true number of individuals experiencing homelessness, because from what we've heard from a number of studies in Canada, the individuals who have experienced homelessness self-resolve their homelessness within 14 days. So they never actually come into our system and access our system or systems. And so we don't, I guess, they actually know the total number of homeless. We know that 1,400 and I think 20 some individuals access our services regularly, have signed consent and to be within our system and are accessing those shelter services, those resting spaces services. We also recognize that a number of those folks couch surf, right? And so the hidden homeless conversation that we talk about, people who are living unsheltered, people who are couch surfing, that's mostly the hidden homeless. And so we have currently 300 shelter beds in our system. We currently have 35, I want to say, resting spaces in our system. And then we have agencies that Sarah operate that provide a number of supports and resources to individuals that are only partially funded. So the exact gap is one that we look at through interaction with our system, and it's that 125, as I mentioned earlier. That would be the typical gap. You might hear numbers as high as 300 and 400 of individuals experiencing unsheltered homelessness. A lot of times what we're seeing is those individuals are on the street for that social interaction. They may be housed, they may be staying in shelter, they may be couch surfing, but they're really accessing the street areas for some of that interaction.
Thank you. Craig, on the remote sites, is transportation going to be available 24/7?
Yeah, so that is part of the plan that each individual will have to work out with the agency, right? So if an individual leaves, there is the expectation that the agency will also have that return plan for them. We don't want to see people walking, obviously, but we do recognize that the agency within their transportation planning can accommodate that. And whether it's, like I say, through working and chips with taxi company, with working with some other partner agencies in community, we are allowing that initial flexibility for each determine their needs and go off-site. And if resources can be brought on-site, how do we do that in the right way for individuals?
Thank you, Craig. This may have been addressed already during the presentation, but what are the efforts being made to ensure safe injection? Is the SIS collaborating with this? And what is included in the harm reduction kit?
Well, that's a good question. I don't think I know exactly what's included in the harm reduction kit, but if anybody has an identified need for using, we do recognize that there is the safe injection site, and transportation will be facilitated to those spaces. We have seen a lot of success in some of our existing responses with the buddy system for individuals who use. We will work with the agencies on what the individual needs are. And if there are needs to access the safe injection site, we'll definitely have agencies will definitely facilitate that.
Thank you. We have a question about the day space, and it's, so will there be a single day space at the Y?
So I'll answer this question and ask Sarah to chime in at any point, but yes, that's what I understand. It operates from 8 a.m. to 8 p.m. And as of December 1, and will be able to support 48 individuals. So I see nodding head there, yeah. I had to read back to remember my presentation.
Thank you, Craig. With respect to the question regarding food expenses, do you know the value of the gift in kind for food last year? It might be helpful to know the full cost of the program, appreciating that the gifts in kind do reduce the dollars.
Sure. Debbie, do we know that number off the top of our head? No, we can endeavor to put it on the Get Involved page, I think, once we'll be able to track it down. I would harbor a guess that it's over or close to $1 million. When you look at all the snacks that we did for the term, as well as providing 3 meals and snacks a day to each site in each location, it is quite significant. But that's also in addition to the meals that the food bank is currently providing to our service agencies in community. And so I know they still provide dinners for individuals who access safe space. They're providing support and meals for London Cares outreach teams. So there is it's a broader donation than just necessarily maybe what the winter response is.
Thank you. So staying on the subject of costs, do we have an estimated cost for the cost of transportation or a projected budget for that?
I think we looked at putting an initial amount of, looking at Debbie for this one. I'm not going to say, I don't want to misquote. I know Debbie worked on drafting the budget for last year and worked with agencies on the opportunities for transportation. And so I'll turn it to her maybe to speak to what we've put in for this budget this year.
I was afraid you were going to do that, Craig, because I don't have it in front of me. Can we also communicate that number? But we have recognized that we have to extend that slightly for the 2 outside sites. And I know I have the transportation in there, but I don't have it in front of me. I apologize. If we could go to the next question, I can find it.
Okay, we can do that, Debbie.
Thank you.
We have a question around the fact that December 1st is not far away, and it seems like a lot of work to be ready until that time. And then just clarifying the location for the nighttime drop-in space and when you might have that available.
Yeah, great. Thanks. Good questions. And, you know, it is it is the nights are getting cold, and the winter response is a part of the broader homeless prevention system, and one that we are very busy with every single day. It seems like there's always curveballs coming at us for the various responses and programs we offer. I don't think Sarah can share right now the location of the overnight response. I know they're still negotiating some contractual obligations and when it can actually open, but we are that space, as the day space, is actually already operating, and so they can take up those individuals, and are currently supporting a number of individuals during the day. And the best guess we have right now for the overnight space, for the resting space, is that January 1st. As Sarah puts her hand up, I will let her. I don't want to speak out of turn there. I'm gonna let Sarah augment that if she likes.
I will take a little bit of the risk on here to say that because we're quite far down the path to be able to operationalize this quickly. And so it is a local location to where the Y is, walking distance. And it is a faith-based organization has offered us space in that area. And so we're just waiting for their council to review the final contract. They're really eager to be part of this in every way, including the in-kind contributions that we've already talked about, the ways that they will be supporting. And we have been talking about, as you know, Advent happens right in the middle of this, and that's one of the challenges of being fully operational for December 1st and every night in December. But we are planning to be operational in December with a couple of scheduling challenges that we're just working out. What will we do in an alternative fashion? So that's why we can't say we will be operational every night beginning December 1st, but we will be operational throughout December. There's a few nights we may not be able to run.
Okay, thank you, Sarah. There's a question about how do you identify the participants or the individuals who will be served if there are only 30 beds at one site? What's the process for providing those services and identifying who has access to them?
Sure, great, thanks. That's another good question, and one we don't probably talk about enough. I'll turn this over to Debbie after I kind of do my butcher of the answer, perhaps. But we operate a coordinated access system here in the city, and it's something that we've been really focusing on over the last year and a half as part of some of our funding arrangements with the federal and provincial governments. Data is really something that we're trying to really understand, as well as the experience of the individual. And so I think a lot of these responses that we look at for the winter response are really focused on the interactions and understanding of the individual. It's an individual-based support. We recognize it's a choice-based support, and we want to make sure that we're giving individuals the best opportunity to support them in the moment with the needs that they have. And I think Debbie can speak a little bit further to the work her teams have been doing and the messaging they've been hearing on the streets about people looking to find safer space, perhaps out of the core, to try and get stabilized and support for finding housing. We have a number of folks that are experiencing unsheltered homelessness that are paper ready. It's just a real difficult opportunity to try and get them to a housing showing because they have belongings they don't want to leave. Maybe they have a pet that they can't care for or can't find a space for. So having them at one location through the winter does provide that opportunity for their belongings to be locked into space and be secured, provide somebody to be able to care for their pet in the moment so that they can go to a showing. It also gives them the opportunity to have a shower, find appropriate and new clothing, and be able to be at their best for when they go see a housing placement and are ready for that process. I don't know if Debbie, you want to add anything to that? I'm sure you have a much better answer than I do, but feel free.
You called me out there and then you answered it completely. So you're absolutely right, Craig. We have feet on the street where we engage with individuals every single day. We are told what it is that they are looking for as they are engaging with us on their housing journey. There are difficulties in that when you're living on the street, and this just gives them an opportunity and a step up to help them get to that final step or continue on their destination to a destination of housing. One of the other things that question may be pertaining to is our prioritization. So we do have a very specific program in place through coordinated access where we listened to our social service agencies within our community, and we built a prioritization list, and we will be using that when we are selecting in our process.
That's great. See, Deb, you highlighted a point that I completely missed, and that prioritization is so key. As part of that community process, and through the coordinated access system, the last couple of years, last year alone, we had over 70 service agencies be part of that conversation, part of that prioritization. Now, we do have priorities identified through the funding arrangements that we receive from the provincial and federal government, but there's also a lot of opportunity to customize that to a London need. And so we look at individuals who are experiencing unsheltered homelessness, individuals who are Indigenous, veterans, people that are leaving institutions, like youth transition out of CAS, individuals leaving hospital, as well as people experiencing homelessness for the first time. So we do prioritize individuals, families, and youth. And we have about 8 priorities that help us identify individuals to be able to access the services that become available through our coordinated access. So a lot of the bottom-up aspect of that coordinated access system is really focused around getting people engaged. It's understanding their identification, making sure they can get access to that, get confirmation of income, and as I mentioned, access our services, have consent to access our services, and then be assessed for the support needs, which could range all across the scale. And then on the top end of the coordinated access system are the units that become available to our system, either through partnerships with the city, through nonprofit housing providers, partnerships in the city through private market rents, as well as we're working through that with our social housing providers in our community. So we're working through those options and to try and match individuals as best we can. We recognize we just don't want to give people keys in a house. We've heard from Londoners that they need help finding that, they need help accessing that housing, but they need help maintaining that housing. And so the programs that we've drafted are really focused on those 3 stages for individuals to access housing, to find housing and find that, to access housing, and then to maintain housing. And supports are only one aspect of that. We also include the rental supplements or housing allowances that a number of our programs are able to offer individuals, because we recognize the cost of rental units right now in the city is quite significant.
Thank you, Craig. We have a couple of people, so I'm going to combine some questions here. You had talked about the collection of sharps and needles, and there are a few people who are concerned about what that means for their neighborhoods and the idea of needing to collect needles off their properties. And I wondered if you could just provide some additional information about that.
Yeah, sure. So as part of the response last year, we had the same issue raised as part of some of the responses we provided last year. And so as you notice, there's the yellow needle bins all across the city in many public spaces that people are able to dispose of needles safely. We recognize that, and most people do, we get a lot of needles through those bins, but we also recognize people that don't necessarily discard their needles in a safe way. And so as part of the consideration of the program last year and any program moving forward, there is that needle sweep requirement. And it really is for us to be able to help support that community in those areas. We didn't see a lot of significant needle collections last year during the needle sweep program, but it is one that we do include in our planning for the new responses.
Thank you, Craig. Just going to scroll through. We've got lots of questions in the queue, so I appreciate the interest from everyone. I'll keep going. Are any of these people working, or are there programs or rewards for encouraging people to move into the workforce?
Yeah, I think an individual's ability to obtain employment, as well as look at maybe educational opportunities, are part of their journey, or part of an individual's journey. I think it's part of the conversation as we work with individuals and as they start to stabilize, but it's not the initial part of the conversation. We're really focused on individuals that have been living unsheltered for a good number of months or years, to be able to find that safe space, to be able to find that ability for them to take a breath. So they don't have to worry kind of about where their next meal is coming from, where they're, how are they going to get shoes for winter boots, that kind of thing. I would say as we work through the programs in our system, education and employment become very significant parts of that conversation, and resources do get aligned with individuals at the appropriate time of their planning process, so that they can help support them to find those opportunities.
Thank you, Craig. Are you able to confirm what type of intervention and service that security will provide, and how does security encourage the low barrier service?
And so I think, as we work with our security partners and as the agencies contract the security themselves, I think it's very important that they identify and work with the agencies to provide that understanding of the situation and the people that are actually using the space, right? So we have a number of security agencies in our community, as well as our corporate security team, that are really great at integrating and interacting with individuals and building those relationships with individuals. And everything we do on this world is about relationship building. And it's the same with these sites. It's so important for the security guards to be providing that connection and providing that safety that some individuals may need. And so we look at the work that they do and as they work with the agencies to establish sort of what the give and take is on that work. We recognize it may be more prevalent on some spaces than others, but we do encourage our agencies as well as our corporate security as we work with them to provide that that relationship building and response to understand the situation that people are coming from.
Thank you. We have a question now about the Fanshawe site. So with this site expected to shelter individuals who are housing ready, what impact do you expect this will bring to the emergency shelter system? Will this change who is accessing the shelters downtown?
It might, traditionally the people that were probably put in this space are not usually accessing the emergency shelters. That's why they're living outside, right? And they're living unsheltered. They find for various reasons, whether it's past trauma or, they might have a pet or they might want to be staying with a mate or a loved one, that they can't access those services. And so what we're recognizing is the need to be able to support those folks that are on the unsheltered experience.
Thanks, Craig. How will the success of the winter response program be measured?
That's a great question. I think a lot of it's multi-pronged, I think. And for us, it's really moving people along in their housing journey, right? And so we recognize individuals engage with our support services in the city differently. For us, we've got to build trust with individuals. And we've got to build rapport with individuals. And so we can measure numbers. We do that very easily through our HIFIS database, and we can measure who's been housed and who's accessed services. But I really think it is around the engagement of services and whether or not people are actively engaged in resolving their homelessness. I think for us, to me, that's what I think would be the best outcome is if we can house a number of folks, but also if we're moving the bar for individuals in their journey, right? That they're now trusting the system, that they're now looking to engage supports differently and aren't abandoned on the streets.
Okay. So regarding the crisis spaces, Craig, how are they accessed in a timely manner so that someone who is in need of those services are not waiting in crisis for days?
Yeah, so the spaces, as I mentioned, are direct referral through our London Police Services, our the Coast pilot model, which incorporates a police officer and a mental health worker, as well as our coordinated informed response team. So those agencies will work through CMHA to refer individuals to those spaces. They are short in duration in those spaces. So part of the work is around initial stabilization, but then it's also around some clinical conversations. And then what are your next steps, right? Do we need to access shelter? Do we need to access other resources? Can we divert you from accessing emergency shelters? Are there things we can do to help you get reconnected maybe to family if that's an option for an individual? So it really just, again, allows somebody a space to stabilize so that they're not out in the elements and that we're not potentially having these conversations on the side of the road when somebody isn't experienced that in the moment crisis where things have just become too much for them.
Thank you, Craig. Earlier in the presentation, you mentioned that the spaces outside of the city are for people who may be struggling with difficulties that are presented by being in the core. And can you provide a little bit more information about what the difficulties may be referring to?
Yeah, I think I'm going to lob this one over to Debbie. I think you have worked with and spoken to a number of individuals who've expressed that concern to both yourself and your team. So I'll let Debbie weigh in on that one.
Absolutely. People identify that although the services they require, most of them are in the core, but that's why they stay there. And if they would like to get away from a partner, a drug debt, any kind of conflict that they have to face every day by seeing other individuals in the core. They've identified that they want to step outside of that for some protection and would prefer to be somewhere where they can get away from just their day-to-day struggle in the street and be protected with wraparound services and focus on themselves, and their housing journey.
Thank you, Debbie.
Mhm.
There are a couple of questions on alternatives and what may or may not have been considered. So I'm going to combine them, Craig, and just give you a few of the ones that I've mentioned. So one is, why is the Thames Valley Golf Course not an option? And another question is about whether or not anyone has approached motel owners to do long-term rentals with the city to provide these spaces.
Yeah, great. Thanks, Patty. Those are both really good questions. And as part of the assessments of the other golf courses, city-owned golf courses here, the Thames Valley site didn't meet sort of the AODA requirements for accessibility at this moment in time. I know they're undertaking a significant renovation in the near future to help meet those requirements, but where the trailers needed to be located, in addition to how they were going to access the clubhouse, was very problematic, and really quickly became apparent that these sites were not easily accessible. We had a number of individuals who had needs last year for accessibility, and so we didn't want to have a site that didn't necessarily meet those needs. For the other motel aspects, we have a number of agreements currently in place with a number of motel providers here in the city, both short and long term. We did not look at private market options or private, I guess hotels would be considered sort of some of the non-city owned options as a direction from council last year. We do still have a number of hotel rooms in the spaces. What we have been finding, though, is individuals experiencing homelessness, unsheltered homelessness. We do try the spaces in hotels if appropriate, and again, it's a choice-based item. You would think somebody wouldn't want to stay in a hotel, but there are individuals out there that experience unsheltered homelessness that is just not a great area for them to be successful. And so it's really great for an individual to be able to identify some of their barriers and their challenges. And it's then on us to be able to try and support that individual with their specific needs in the moment.
Thank you. We have a few questions related to supports available for sex workers that may be staying at these sites. I'm not sure if there's any information to share on that.
We have our Street Level Women at Risk program, and that program gets matched through the London Police Services. So if individuals are identifying as street workers or sex workers on the site, we will make sure that there is that initial conversation, if they're not part of that program already, to ensure that the resources and the initial conversations happen to be able to get those supports in place for those individuals.
Thank you, Craig. Will food and water be available 24/7? The question says in the clubhouse, but I'm not sure if that's just referring to the various sites.
Yeah, I would think snacks and water are available to anybody 24/7. A lot of times individuals have their own secure locked space, and so they might take a bottle of water with them when they go to bed, or a snack in the evening. I don't know, again, it's all based on the operationalization of the spaces by the agencies, and those are, I'm sure, considerations they take into account. And I don't know, Sarah, you want to speak a little bit to how that worked last year at the winter space? Were people provided snacks and food and water 24/7?
Yes, we were able to do that, and I'm sure that would be part of the program. People do talk about, based on their activities of daily living, what they need to do, that, prescribed meal times, as it is for you and I'm going to have dinner late tonight. Maybe you are too. That's a normal part of life. And so, yes, absolutely. This winter response does account for that.
Yeah, that's a great point to make, Sarah. The flexibility for all the work that we do is so key and so important. We recognize that the cookie cutter approach for really a lot of the things we do don't work for everybody. And so we have to be open and flexible to be able to provide supports for individuals to build that trust and build those relationships.
Thank you, Craig. So a question about the funding for this. So the temporary response last year, as well as the temporary response this year, are funded from additional provincial or federal dollars. If these were not available, what would the city have done? And what is the longer term plan for city funding when or if there's no funding from other levels of government?
Yeah, that's a good question, and probably something we try to deal with and understand every single day. Our municipal government and the federal and provincial governments make currently pretty significant investments into the City of London ongoing. The COVID-19 response funding has been specific to providing COVID-19 responses. As most people know, we're undertaking a current RFP for our shelter system to try and change the dynamics of that system so that we're able to promote individuals to access it differently. We're also, working on a number of housing plans. It's this very connected system. It's a very complex system, and shelter provision or the winter response is a very important, but sometimes smaller piece to some of the work that we do. And so we're always advocating for more federal and provincial dollars. We try not to ask for significant tax-based dollars because we recognize the burden on local taxpayers. We're all taxpayers, but I think for us, it is looking at making sure that a lot of the work that we do ties into the other work that's happening in the system, right? And through a lot of that work, you can find efficiencies and you can find some linkages that help people journey from street to housing.
Thank you, Craig. Here's a question about the medical bus and whether or not it will be accessing the remote sites, or will individual agency transportation be solely responsible for getting participants to basic medical care while they're remote from core services?
Yeah, that's another great question. I think we're still, as I mentioned earlier in my presentation, we're still having those conversations. What we've heard is it really depends on who's at the space. And if individuals are already accessing those services and they're connected to those services, there might be an opportunity for a mobile response. But if not, as part of the work that, again, the agencies are going to do on site is working with the individuals, understanding where they need to go. And if multiple individuals need to go to a community health provider for services, they will have that ability to be able to facilitate that transportation for those individuals, recognizing the COVID protocols that are in place as well, and making sure that individuals are accessing those sites in a safe manner.
Thank you, Craig. There's a question around what kind of security will be provided to the neighborhood where the two sites have been proposed.
Which two sites?
The sites, the Fanshawe Park, I believe.
Oh, right. Okay. Yeah. So I think, the health and safety of all Londoners is definitely paramount to the work that we do every day. And it's a multi-faceted approach, right? It isn't, we have a police service in our community. We work very closely with our London police services. We're providing security in many cases as appropriate fencing on the spaces to try and promote that security. We're limiting visitors to the spaces. We recognized last year that might have been a bit of a challenge for some of the neighborhoods we had for multiple responses. And so we're trying to incorporate the best practices to be able to ensure that those communities are provided that broad safety and ensuring that individuals recognize too that they're part of a community and that the work that they're doing and the work they're doing on their housing journey is to be part of a community.
Thank you, Craig. This question is also related to the security and the selection of services and whether or not everyone who is involved as a participant or a facing worker uses a trauma-informed approach.
The agencies that we've hired or are looking to contract for this response do use a trauma-informed approach. So I think that is generally where our sector is moving towards. We recognize a lot of individuals pre-homelessness, and when you experience homelessness, can be very traumatic. And so you do need to have that lens. It was a key component of our RFP for our shelter program, our outreach program, and our housing stability bank programs as part of that general RFP. So it is that lens is something that the city is ensuring is becoming a greater and greater part in all the work that we help facilitate.
Thank you, Craig. So how will the golf course sites be handling people's rights to privacy? So what will the policies be for staff entering people's rooms, for example?
Again, that's a good question. And I know last year, Sarah and her team put a number of policies in place for privacy, and maybe she can speak to that. And part of the conversations we'll have with those agencies, if they get contracted, will be around establishing that and making sure that individuals' privacy is respected while still having the appropriate numbers of check-ins or appropriate engagement with individuals. Is that something you can speak to, Sarah, around individuals' privacy from last year?
Sure. And I do think, you said the right thing by saying it's the organizations and their programs, because different programs with various objectives are going to have different approaches. Our policies last year very much centered on the low barrier harm reduction approach. And it was in consultation with residents what that protocol looked like. We actually designed it as we were operating. And it was a community informed strategy around access. And of course, there is responsibility in terms of liability for organizations. And that is why it's important for each organization to contemplate what their objectives are, work with the residents, and follow their vision, mission, values, and their organizational policies to really implement that. So I imagine it could look different for these responses, and I think that's completely appropriate.
Thanks, Sarah. I think you hit on a really good point that maybe I'll ask you to speak about a little bit more, is around the community focus and the monthly and weekly and probably daily meetings you had with individuals from the site to create that sense of community and the expectation your agency put on individuals that were accessing your site to be part of the solution and to provide input to the solution. I think that was so key and such a key learning from your experience last year, and it is one that we are working with agencies on to ensure it gets implemented this year. But would you be able to touch briefly on sort of some of what that looked like within the Elizabeth Street site?
Certainly. And I look forward to sort of seeing how it's operationalized differently in these new sites. I have to say I've reached out already to say, hey, I want to continue to learn. But the way it worked for us last year is it was so many organizations came together to collaborate on what winter interim response to homelessness sheltering would look like. And so even right from the design of what we were going to do, how we were going to do it, there were many voices present. And we set out the criteria at the get-go that it would be a community-led initiative. And that isn't always perfect, but that started with the governance and operational planning, all the way through to engaging residents. And so what that looked like was a weekly community meeting. We did talk about what the expectations, for example, for residents would be and what we would do given the winter months. And you don't want to be sending people out into the cold, but what happens if in a community you're having conflict or challenge? What can we do together? And what we found is that people, as they began to trust that we were quite serious about letting their voices help shape the process, that we could count on them equally to help implement those things on the site. And so, this is grassroots type of work. One of the questions was about, does everyone have the trauma-informed lens? And I would want to just say that when you are working with organizations like the ARC or, those that are, we're a hybrid between staff and volunteers, and we value lived experience. And so people's understanding of those kind of what I consider to be buzzwords of social work or this field, it does vary. But when you take those concepts and you apply them in a community, the community actually helps shape what that looks like in that community. And that's what we found in the winter response last year.
Great. Thanks, Sarah. I think it really highlights those intangibles of when you bring community together and you do that work around individuals' choice for those spaces, right? So it happens organically in many cases, and it can be sometimes difficult or hard to put to a point on how you're going to absolutely recreate that again this year. And I think for us, that you mentioned that it is important for the agencies to have those differing philosophies. They have differing philosophies in our community, which is a good thing. But it also then, makes it work for the city to ensure that agencies, hey, some of these were good things that worked last year. It's important for you to maybe consider those for your response this year, recognizing that, what we're looking at doing this year can be a little bit different in some of those remoter locations. But thanks appreciate that dynamic.
Thank you to both of you. The next question is about how will we address the fact that people who do not live at these sites will be coming up to seek shelter there? Will transportation be provided for these people to help them get back to the city? Apparently, people had walked up to the Wish looking for shelter, and there's a concern that these sites will be the same and that people will appear and then have no way to get back to the core.
Yeah, no, I think that's a good question, and it was something we saw in a number of cases last year with both of the sheltering responses in the core. I think from these cases, part of the challenge that we're going to have is giving again the agencies the ability to facilitate that, right? And so agencies are going to be very connected to our system. If somebody is coming up during the day, they may be new to the experience of homelessness, or could just be from that community. We did see quite a number of new individuals come through when we were at the Hamilton Road location and never accessing services before and coming to the location to access service. So for us, we'll have to understand that dynamic. Is somebody coming to be on the site? We are messaging quite clearly through our outreach teams now that these sites are not attend sites, that we are matching to that. If people want to be are interested in this, then let's have that conversation. But if somebody does come to the site, does need to get connected to services, we definitely have resources, outreach programs that can connect with that individual quite quickly to facilitate them to a shelter as appropriate, or to work with our coordinated informed response team around maybe potential diversion opportunities so they don't have to experience emergency shelter, or other opportunities for them to just get out of the cold.
Thank you, Craig. So there's a question about the neighborhoods, and wondering whether or not individuals who are being supported at the more remote shelter locations or at any of the locations be in the neighborhoods during the day and at night, and what will be done if people are infringing on the residents? How will you address that?
Yeah, and I think that's again another good question, and something we deal with. I think every program and everything support service deals with differently. I think from our perspective, having that very established sign in, sign out process, understanding what people are leaving the site, where they're going, and then the regular check-in with individuals, right? If somebody's checked out that they want to go for a walk or want to walk around the grounds and they haven't come back within a half an hour, there is that check and balance in place to make sure we understand that. If there are concerns or are issues that residents are seeing, we've heard through committee that the Elizabeth Street site last year, and Sarah might go to speak to this a little bit more, created great establishment, great communications within community, right? And so I really hope that a number of these agencies would work out with community, host and engage our community partners. It's an expectation we have of them, because I think you can't work in a silo in that community, and that building that community and having be part of that community is so important, both for the benefits and then sometimes the challenges that we see in day-to-day life. And if you want to speak with that at all, I know there were some great stories shared, Sarah, by Councillor Helmer at committee, and some of the work that he was aware of. I don't know if there's anything relevant to that you want to share.
Well, first of all, I do want to acknowledge the neighbors. There were some very kind neighbors that really did add to the richness of our program, also to our community, and added to the safety and care that people experienced last winter. So just a shout out to those residents. I want to acknowledge also that it is, if you have not been directly in the face of deep poverty and those deprived of housing, it is incredibly uncomfortable that when you have a warm bed to sleep in and a place to go at night, having this in your neighborhood, I think we kind of think about sort of the worst case scenarios, and we forget that we're actually just uncomfortable. It's uncomfortable that we're having to come up with short-term solutions. It's uncomfortable for why are people outside? Like, can't we solve this problem? We live in Canada, for goodness sake, such a great country, right? And so I think that discomfort sometimes comes out as community members, as neighbors, in these ideas of fear. But really, what I'd like to suggest is that we all know people who have struggled with different things. And when people walk off their home, their site, the place that they're going to be calling home for the winter, just like when you sometimes go for a walk to kind of cool off or feel better or take care of yourself, it's very much driven by those same things. What is different is your neighbors know you and they nod when you're walking past the street or whatever, and you don't know these people. So I would just encourage you to live a little bit with that discomfort, recognize that your community is being impacted, certainly, by this coming into your space, right? Into something that you're seeing every day. I've only been here at the ARC for, just over 18 months, and I've been a social worker my whole life. This is the most uncomfortable I've ever been, because I go home every night, and every night I leave people as I'm driving out of the parking lot who don't have a home. It's very, very uncomfortable. And so I just want to recognize for those who are kind of feeling uncomfortable, unsure, what does this mean for me? There's a lot of teachable moments in this. I have 4 children. They've all been involved with the Wish to Be Home project and with the ARC. And I do believe that for all the concerns that are shared, there's a lot of learning. We actually had a beautiful kid on Elizabeth Street write a letter to the paper talking about what she's learned by having the shelter close to her home. So, I do know that, again, there's that tension of discomfort and also really wondering, can we do more for our community? And I'm proud of our city for stepping up, but I also acknowledge that this is where the rubber hits the road. It comes into your space. And so if you're struggling a little bit with this, that's understandable. I encourage you to think about the ways you can add to the richness of the community response when it comes to these projects. Thank you.
Thank you, Sarah. There's a question about what non-short term, so brackets more than 3 days, options are being put forward for individuals who can't or perhaps won't access current core shelters or aren't comfortable living outside the city. Are there options?
Good question. I'm just trying to think of we have quite a significant number of responses in our community beyond just emergency shelter, right? And so we look at individuals who are experiencing homelessness and want to access shelter. There is that option for them to present and obtain a shelter bed. Generally, there is no limit on how long they can stay. We are working towards housing, so hopefully they, as they access shelter, they get into that housing mode. We do find a number of the resting spaces and those stabilization spaces as proposed, and some of the other spaces are trying to deal with some of those in the moment challenges that people might have that aren't comfortable accessing those broader, larger type emergency response systems. And so I know the agencies and the programs that operate those resting space systems, they see people come in and out all the time and try to get them connected to services. But beyond our existing response with the emergency shelters, that is your probably more than 3 days opportunity should you wish to stay in those spaces. Anything less than that, we do have a good number of resting spaces through this winter response, but also just in general. Deb, am I missing something there? Is there anything else that you can think of that we provide? I'm just trying to understand the question a little bit more beyond kind of that emergency shelter, but I think I've hit the nail on the head there. Like we have those 300 shelter beds, right? And that is the core emergency response system here in the City of London.
Yep.
Okay, thank you. Deb, did you want to add anything to that, or?
Sorry, I just got myself off of mute and put myself back on. No, I was just reiterating what Craig said. Yes, our shelter system has 300 beds. We have multiple resting spaces and many housing actions in between. So this is in addition to all of that.
Thank you. So there's a question about how individuals who may be sleeping rough may be informed about the options that are available to them. So how do those who do not access shelter or service get informed about the response and how to become considered as an individual who can be supported at one of the trailer sites?
Absolutely. I'll take this if that's okay, Craig. We already have outreach teams on the street. This is for unsheltered homelessness. This is something that is where we really want to focus winter response and our and exactly that winter response, because the individuals who choose to stay out unsheltered or can't access shelter for various reasons, these are the individuals we really want to focus winter response on. So we have our own outreach team that we fund through CIR, but there are several other outreach teams out there that we engage on a regular basis. We have feet on the street everywhere, and the message is already getting out for engaging and seeing who wants to be part of the response and what they would like to participate in. So it's a daily 24/7, 7 days a week outreach team that is constantly engaging with the unsheltered.
And I would add, if anybody on the phone is looking or is aware of somebody that might be experiencing unsheltered homelessness, 661 Home is our general number for individuals that need some assistance and help with housing or homelessness, or service@london.ca, and then that can be logged and tagged to our outreach teams to be able to reach out and connect to the individual or yourself to start having those conversations to make sure people get connected.
Thank you, Craig. A couple of questions have come through just around the repercussions or the precedent that's set by moving people who are experiencing homelessness to the outskirts of the city. So how will you address the potential that this is setting a precedent and that this may be something that shifts the way the community approaches homelessness in the future?
Interesting question. I think, it's a great question. For me, homelessness is a city-wide problem here in the City of London. It's not just a core problem, right? We see homeless individuals and challenges all across our great city. And so it isn't a core issue. I don't think it's a precedent setting in my mind. We need to meet people where they're at, and we need to also support people in different ways. We're challenging this system on how we've always traditionally done things. You'll see a lot of probably changes happening in the next 6 to 8 months on the Housing Stability Services side, just so that we can recognize people's needs in the moment and do better to support individuals and not just cookie cutter approach it. I think it's so important for us to have that individual-based planning, housing-specific planning, really housing-focused, because I think as we align a lot of the work that we do, we recognize the solution to homelessness is housing, and then it's matching folks as they need to the supports and services for them to be successful and achieve housing stability.
Thank you, Craig. We're at 7:25, so we do have time for a couple of more questions, but I will remind people, if we don't get to your question this evening, we'll be able to post those on our Get Involved site. So we will track the answers down and then post the information on our Get Involved site. But we do have a few more minutes to get through a couple of additional questions at this time. So Craig,
real quick, Patty, sorry, before you go into the next question. So I was able to kind of look through some of the budgets and some of the expectations around transportation. That question came in earlier. And so we've earmarked, an approximate value of about $30,000 for transportation for each of the 2 locations. We've also included a contingency, but really it is still to be determined the exact amount with the agency, depending on the style of transportation that is needed for their community response, right? And that response in that area. So we've put a line in. We are flexible working with the agency, but also ensuring that the dollars are spent in an accountable, transparent way, and that we are efficiently using all tax dollars, not just municipal tax dollars here with the city programs that we operate.
Okay, thank you, Craig. So the one question I'll ask you is, what is the referral process for community partners? So for example, a hospital, if there are community partners that would like to refer people to any of the options that you've discussed.
Yeah, so I think great question, and we are getting more upstream in a lot of the discharge planning for institutions, both hospitals and corrections facilities, CAS transition out of care there. So what I would suggest is seeing if we're active in that area that you're working within. We're quite our programs, our No Fixed Address program works quite a lot at Victoria Hospital and University Hospital. Our 661 home number is always a good starting point for individuals that are experiencing homelessness and need supports, right? It might be a referral to this resource, but it might be other resources depending on their needs and their desires and their wishes, right? We always start with diversion. That is always our goal, is to actually divert people from actually using these systems. But we do recognize that people do need these supports. And so we work with the individual and work with the support agencies to support the individual. So it's that 661 home number, as well as housingstability@london.ca is another good email.
Okay, thank you, Craig. So with 3 minutes left in the time that we have, there have been a couple of questions around the purpose of tonight and whether it was a consultation or really to just inform. So the goal of tonight was really to provide answers to questions that people may have about the plan that's come forward and the details that are included in it. if you do have comments and feedback, you can provide that through our Get Involved site. And I believe, Craig, you can clarify, this is coming to council as well on November 16th is the date. So there's an opportunity to provide feedback in writing to council through our clerks. And on the 16th is when they'll be making the decision on whether or not this moves forward. So it's been approved by committee and it will go to council on November 16th.
Yep, that's correct.
Okay, Craig, with 2 minutes left, are there any kind of concluding comments or any just closing remarks that you or Sarah or Debbie would like to make?
Yeah, sure. You know, I'd like to thank everybody for taking their time on a Tuesday evening. I know everybody's lives are, I'm sure, busy, and this is any work that we do on the Housing Stability Services side is very, it's very focused, right? And I think community has a great interest on the work that we do, and so we do have a lot of resources available on our website for people to to get engaged and to learn about the work that we're doing through our Housing Stability Action Plan, through the Core Area Action Plan, Council Strategic Plan. So there's a lot of that work that individuals can look to sort of read, and then if they have questions, reach out to us. You know, we are here for that to answer questions and to support individuals and support Londoners in some of those questions. As I mentioned, we are shifting our system quite significantly over the next little while. So I think it's important as we do the work to communicate out, we also recognize that people have an opportunity to communicate in. And so these kinds of information sessions are so key for us. When we have time, we try to do it regularly. We are engaging with our London Homeless Coalition later this month to talk about some of the various aspects of our system and provide updates and some learnings to that coalition. So we can share that information with anybody who is interested on this call. But, you know, I want to just thank everybody for your questions. Thank everybody for your time. And, you know, the work we do is very, very hard. You probably see that every single day. Sarah can attest to that. This work is hard. And you take it home with you. I totally agree with Sarah that, you know, when I get to go home every night to a warm bed and to my kids, it's emotional. And, you know, we recognize in our community that a lot of people are struggling. So I think that's what the message I would leave with people is that we take this work to heart.
So with that, I will thank Craig, Sarah, and Debbie for the information that you've been able to provide tonight. I will thank the people who have been able to attend and who have provided some very thoughtful questions that we will work to make sure that we continue to answer in the coming days, so that any of the information that you've requested or that you've been looking for more information on, we'll post that on our Get Involved site. Anything that I've missed, team, or are we good to say thank you and call it a night? Okay, thanks very much, everyone. Good night.